It is estimated that there are over 77.5 million dogs in the United States alone, and 1 in 5 dogs is suffering from some form of arthritis. Therefore, there are over 15.5 million dogs in the United States who are suffering right now. The question is why, and what can we do about it? We first need to understand what arthritis is itself. Then, how and why dogs actually get arthritis. And finally, we can then discuss how to prevent this horrible disease so that your dog can have a lifetime of healthy and pain-free joints. In video 1, we're going to cover the basics of dog arthritis, what to look for and how to diagnose it. In video 2, we're going to cover prevention and natural treatments. And in video 3, we're going to look at moderate to severe arthritis, including all the medications and the available resources. Let's look at a normal synovial joint. The end of each bone is covered in smooth cartilage. The entire joint is then surrounded in a joint capsule, which contains the joint fluid that lubricates the joint. The joint is then further supported on the outside by muscles and tendons. Arthritis is defined as inflammation in the joint, which is usually accompanied by pain, swelling, and stiffness. There are 3 forms of arthritis. The first is called osteoarthritis or degenerative joint disease. The second is rheumatoid arthritis or immune-mediated arthritis. And the third is bacterial arthritis or septic arthritis. For our purposes, we're going to be looking at only osteoarthritis, which can then be further broken down into mild, moderate, and severe arthritis. The most common places dogs get arthritis is in their hips, their knees, their elbows, and their shoulders, and then of course their spine, which is broken down into cervical, thoracic, and lumbar, the lumbar spine being the one most commonly affected of the 3. There are a number of potential underlying causes of arthritis, such as overnutrition at a young age, which has been linked to hip dysplasia, or congenital malformations. There's always, of course, obesity, which adds immense stress to the body. And then, of course, trauma or any kind of joint injury. Last but not least is any normal age-related changes that occur over time. Let's quickly review something we call the silent suffering scenario. Let's say this is your dog and they experience some degree of pain while doing normal activities such as getting up or climbing stairs. Because these normal activities are uncomfortable for them, they begin to avoid them and you find that your dog is laying around more. Because the body's not asked to do these things, your dog slowly begins to lose critical muscle mass, i.e. muscle atrophy. The less muscle mass means the more weight the skeletal system has to carry, which was the source of the pain in the first place. Remember the saying, if you don't use it, you lose it. Whatever you do, don't mistake this slowing down for just getting older. Most likely, your dog is actually suffering with chronic pain. Pain, you ask, but my dog never whimpers or cries, or shows any signs of being in pain. That is by far the biggest misconception that pet owners have about their dogs. Dogs absolutely do not show the same signs of pain as people do, period. People complain verbally, we whine, we cry. Dogs, on the other hand, are very quiet and humble when it comes to showing pain. Now we're going to cover the 12 most subtle signs of dog arthritis. Sign number 1, slowing down. As we stated before, don't mistake the just getting older with the signs of dog arthritis. Many times people mistake that their dog's slowing down is actually just a sign of getting older. Sign number 2, sleeping more and sleeping longer. Many times people notice that their dog seems to be sleeping more, especially in the morning. They'll often be reluctant to get out of bed. Sign number 3, closed hind leg stance. If your dog's hips and knees are arthritic and therefore painful, oftentimes while standing you'll see that their back legs are closer together. What they're trying to do is shift their weight off of their hind legs into their front. Sign number 4, wide front leg stance. What you'll see in this case is that the elbows are actually pushed out and not kept under the dog's body, giving your dog a very wide stance in the front. Sign number 5, bunny hopping. Many times owners will notice that when their dog's running, their hind legs are moving together, kind of looking like a rabbit. This is often a telltale sign in a young dog that they have hip dysplasia. Sign number 6, joint licking. Sometimes if one particular joint is bothering your dog, they may begin to lick it in order to pacify the discomfort. Sign number 7, slow to get up. It's pretty self-explanatory and probably the most common noted by pet owners. Sign number 8, reluctance to go on walks and walking less than normal. Often pet owners will notice that their dog's reluctant to go the usual distance. Make sure you look for trends over time. Sign number 9, avoiding stairs or slow to go upstairs and avoiding any kind of jumping in and out of cars, beds, or couches. What was once a normal and easy task is now difficult. Sign number 10, stiffness. Sometimes you may note that your dog's gait is a little more stiff than usual, or you might see that after they get up they're stiffer. Sign number 11, limping. Of course this is an obvious one, but if you notice your dog is limping on just one limb, before you decide for yourself it's arthritis, please contact your veterinarian for an evaluation. And last but not least, sign number 12, muscle loss or muscle atrophy. It's always a good idea to every once in a while run your hands over your dog's body. Make sure you compare right to left. They should be symmetrical for the most part. If you suspect that your dog has arthritis, it's extremely important to have a thorough physical exam performed by a veterinarian. The reason being is this. Everyone assumes that if their dog is starting to show signs of arthritis in their hind end or front end, then it must be due to arthritis in their joints. This is not necessarily true. It could be that your dog actually has perfect joints, and instead the arthritis is in the spine. This is a very important distinction that needs to be made. Why, you ask? I'm going to tell you. This leads me into my final point, which is crucial for the effective management of dog arthritis. You need to have X-rays taken. Now for many this can be a problem. For complete and effective X-rays, many times dogs have to be given some form of sedation in order to have the dog lie calmly on the table. Also, in some cases, pet owners may not have the financial resources to take this very important step. At the end of the day, if you can have X-rays taken, do it, because effective treatment is knowing exactly what you are treating. That's it for video 1. I'm Dr. James St. Clair, and stay tuned for video 2 where we're going to discuss everything with relation to dog arthritis prevention and supplementation. I wish you and your dog the best of health. Take care.